Hi guys, welcome to today's video. Today's learning objectives are to talk about the Pharmaceutical Benefits Scheme, the National Disability Insurance Scheme, and private health insurance. Okay, so first of all, the Pharmaceutical Benefits Scheme. So this is sort of a insurance component of the Australian healthcare system, which subsidises essential medicines. So our little definition here describes it as a key component of the federal government's contribution to the healthcare system, provides subsidised essential medicines to Australians. So the two key things here is that it's subsidised, so certainly not free, but definitely giving people good financial aid, and it's only essential medicines, or what the government feel to be essential medicines. So some key terms we need to understand. Firstly, there is a safety net. So once the individual has spent this certain amount within a calendar year on only the PBS listed medicine, the patient pays only a concession co-payment rate of $6.10 rather than the normal $37.70. So $37.70 is usually how much the individual will have to pay as their co-payment to receive the medicines. But if you're spending so much money on medication that you have reached this $1,453.90, very exact, I know, you're only going to be doing a co-payment of $6.10 for every further medication you buy. And similar to what we're talking about with Medicare, this is to protect very sick people. So protects or chronically sick people who have to spend a lot of money on medication. So the next one we kind of touched on just before, the PBS co-payment, so $37.70 usually is what people will have to pay to access these medications, so that is the subsidised amount, but $6.10 is the alternative once you've reached that safety net figure. So the National Disability Insurance Scheme is somewhat similar to this, but we're focusing on people with permanent and significant disabilities as well as their family and carers. And it seems to be a recurring thing that the government wants to protect people who have to pay a significant amount for healthcare year after year, such as people with disabilities. So the conditions are they must be under 65, they must be an Australian citizen, and they must have a condition which will likely be lifelong, so not a short-term thing such as a broken leg. The impairment must substantially reduce ability to perform basic tasks, including working to achieve an income. And this is one of the reasons why the community of disabled people are targeted, because they usually cannot work to achieve a substantial income which will help them access the healthcare that they need. So therefore we can see them as a very vulnerable population in terms of healthcare outcomes. And so the whole goal of this insurance scheme is to provide access to healthcare, community, services, as well as funding for essential equipment such as wheelchairs. Our next component is the private health insurance, which I'm sure a lot of you are familiar with and maybe a lot of you actually have. So it's a type of insurance under which the members pay a fee, which is called a premium, in return for payment towards health-related costs which are not covered by Medicare. So this is a key component of private health insurance, is that individuals can still use Medicare, but they use their private health insurance for things that Medicare does not cover, such as private hospitals. So there are two types of private health insurance. You don't really need to know these in too much detail, but it's good to be aware of them. The hospital policies, which cover you when you go to hospital, so this is going to make sure you have a shorter waiting list and can access a private hospital. And general treatment policies cover you for additional treatments such as dentistry and physiotherapy, which we said before Medicare does not cover. The gap is the co-payment in which the individuals must pay that Medicare and private health insurance don't cover. So this is the gap between what private health insurance is going to insure you for and what your healthcare practitioner is charging you. An important thing here is that gaps are usually quite large. So this is certainly a disadvantage of private health insurance, is that you're paying so much for it, and even despite all that money, you still have to pay a significant amount to access the treatments that you wish to. And it covers these alternative therapies which Medicare doesn't, such as physiotherapy, orthodontics, massage, optometry, and hearing aids. So some key terms, private health insurance rebate. So individuals receive a certain percentage rebate based on their income, whether or not it is a family account or their age. So if you have a family account, that's obviously what they want, because they want a lot of children and young people signing up for private health insurance. Or if you are at an older age, so between 65 and 70, you're going to receive extra private health insurance. So rebate meaning you're getting some money back. The next one is lifetime health cover, and this is a strategy to ensure people take out private health insurance early. So the rule is that people who take out private health insurance after the age of 31 pay an extra 2% every year they are over 30. This encourages younger people to take out private health insurance and keep it for life. So if you took it out when you were 20 and decided when you were 28, nah, I don't want it anymore, and get it again when you're maybe 35, then you're still going to have to pay this lifetime health cover, because the government want you to keep it for life. And finally, the Medicare levy surcharge is what we went through before, which is people earning a high income who are not taking out private health insurance will pay extra tax towards Medicare. So these three things here, these are what we call incentives for individuals to take out private health insurance, and they're all very strategic by the government to ensure that people are shifting to private health insurance if they can afford it, to ensure the Medicare system and the public health system are not clogged up. Another thing we need to talk about is the advantages and disadvantages of private health insurance. So advantages, quick table. So our advantages is that it covers alternative therapy, so e.g. physio or dentistry or optometry, which the Medicare system does not. And our next advantage is that you can choose doctor in hospital, which you cannot under Medicare. And our third one is that there are shorter waiting lists. So a nice amount of advantages. Disadvantages are obviously that it's very expensive. And the second important one, which I mentioned before, is that the gaps / gap payment is quite large. And the reason for this is that any healthcare practitioner in a private practice is going to charge a lot of money, which private health insurance does not deem necessary or suitable. So they're not going to cover that huge fee. They're going to cover what they think is necessary. Awesome. So I hope that makes sense, and I will see you in the next video.